A neurosurgeon treats and diagnoses a variety of diseases involving the nervous system. For example, we treat cranial diseases such as brain tumor and arteriovenous malformation and aneurysm. In the spinal column and spinal cord, we treat spinal degenerative disease such as herniated disc or spinal stenosis. We also treat diseases involving the peripheral nervous system, for example, the carpal tunnel syndrome and the other nerve entrapment syndromes.
The most common symptoms that bring patients to a neurosurgeon are usually pain and sometimes associated weakness. In terms of brain pathology, the most common symptoms are headaches and possibly nausea or vomiting. When patients have diseases of the spine, they can have associated pain in the neck or lower back and some related symptoms going down their arms or legs, which may or may not include weakness or numbness. The majority of patients who come to see a neurosurgeon actually will not need surgical intervention, and we're able to get them better with non-surgical treatments, such as physical therapy, selective nerve root blocks, or other interventional pain procedures and steroid injections, as well as sometimes seeing a chiropractor and activities adjustments. When patients do need surgery, we like to concentrate on techniques that focuses on minimally invasive types of procedure. And sometimes we have to go and do surgery using traditional open techniques as well. Whenever surgery is needed, we use computer-guided neuronavigation for surgery, for surgical targeting of the exact site of surgery, like the brain tumors. And this ensures the safest type of surgery possible.
Patients who come to a neurosurgeon's office do not always require surgical treatment. For those patients, neurosurgeons serve as a triage to refer them to a team of specialists who would do non-surgical management. The team specialists include, for example, pain specialists, physical therapist, physiatrist. All of them can provide different ways of non-surgical intervention that can potentially provide help to the patient's symptoms. Suburban Hospital has a very unique and exciting opportunity by being very close to National Institute of Health and has very extensive collaboration with researchers and NIH. For example, treating malignant brain tumor is a very challenging situation for neurosurgeons. Most of those patients do not have good outcomes and succumb to the disease within 2 years. However, because we're very close to the NIH, we have extensive referrals to neuro-oncologists at NIH and have our patients with malignant brain tumor to be considered for one of the dozen clinical trials at NIH. As a result, many of my patients survived the disease so far and has been doing very well even after 2 years since their diagnosis. And I think that's the greatest opportunity that we have here at Suburban. The most rewarding thing for me being a neurosurgeon is to see a patient having very, very good outcome after my surgical intervention helped with his or her condition. For example, a few months ago, I was operating on a patient who suffered severe head trauma. He almost died. He's very close to being not able to rescue at all. However, after his surgery now, several months later, he was talking, feeding himself, he's walking with mild weakness, but he was able to interact with his family. He's enjoying very good quality of life. To me, that's a good save.
The most rewarding thing about being a neurosurgeon is being able to be there and help patients get better. Probably the most rewarding is when I see a patient who previously was in a wheelchair, we've done surgery, and they come back, walk through the door, and give me a hug.